What would you do if something bad happened to the world and we were forced to go back living off the land? Here are a few tips for survival. To survive cold weather when you cannot build a fire, wear the proper type of clothing, no cotton. Stay dry, use water-repellent outer garments. Build a shelter. The best is a nylon tarp shelter as it will protect you from wind, rain, and snow. Insulate the floor of the shelter with pine boughs, if available. Avoid contact with cold surfaces, the ground, rocks, or snow. Wrap your body in a thermal fill blanket. This will maintain a temperature of 60 F inside the wrap even when the outside temperature is 10 F. Limit your physical activity to conserve energy. Heat exhaustion. Heat exhaustion is the opposite of hypothermia. Core body temperature increases, usually as a result of hot and humid conditions, plus a lack of water. Prevention of heat exhaustion. Drink plenty of water. Take frequent breaks if you're hiking to or from your hunting spot, especially when carrying a large load. Dress in layers and shed layers as physical activity increases. Symptoms of heat exhaustion: pale and clammy skin, dry mouth, fatiguizations, head chemical cramps. Treatment of heat exhaustion. Move the victim to a cooler place. Have the victim drink water or sports drinks. Keep the victim inactive. Fan to lower body temperature, but don't overchill. In severe cases, seek medical attention. Heat stroke. Heat stroke should be treated as a medical emergency, can be fatal. Symptoms of heat stroke: dry, hot, and flushed skin, dark or purple in color. Dilated pupils, rapid, weak pulse. Shallow breathing. High temperature may be in excess of 106 Fahrenheit. Treatment of heat stroke: wrap in a sheet and soak with cool, not cold water. Fan, but don't overchill. Get to a hospital immediately. Basic first aid. Every hunter should take a first aid course to learn what to do in case of injuries. Broken bones, bleeding, and burns are some of the common injuries that could occur while hunting. Severe bleeding is a life-threatening medical emergency. The rapid loss of just pints of blood can result in shock and loss of consciousness. A victim can bleed to death in a short time. To stop bleeding, apply direct pressure on the wound. Cover with a sterile gauze. Put the cleanest cloth readily available. Concerns about infection are secondary when it comes to preventing massive blood loss. Press the pad firmly over the wound using the palm of your hand. Don't lift the pad to check the wounded, will only renew bleeding. When a pad becomes soaked, put a fresh one directly over the old pad. If the wound is on a limb and there's no fracture, raise the limb above the level of the heart. Gravity will reduce the blood pressure in the limb. Direct pressure and elevation are usually sufficient to stop bleeding. If profuse bleeding continues, try shutting off circulation in the artery that supplies blood to the injured limb. First aid: broken bones. You can assume someone has a broken bone if pain lasts more than a few minutes. Moving the injured area is difficult, or there is swelling in the injured area. If you have to transport the victim a long distance, it's best to immobilize the joint above and below the break to prevent further injury and relieve pain. Don't try to straighten the limb, splint it the way you found it. For a broken foot, do not remove the shoe. Tie a pillow or thick padding round the foot over the shoe. To splint a broken leg, place a blanket or some other type of thick padding between the legs. Bind the injured leg to the uninjured one with strips of cloth. Bind the legs together snugly at several places above and below the painful area. Moving an injured person. Moving a victim with a head, neck, or spinal cord injury should be left to paramedics or other professionals, because permanent damage could result from improper handling. If a victim must be pulled to safety, move him or her lengthwise and head first, supporting the head and neck. Keep the spine in alignment. First aid: burns, CO poisoning, and chest wounds. Treating burns. For burns, the immediate goals are to relieve pain, prevent infection, and treat for shock. First, and second-degree burns with closed blisters are best treated with cold water. Immerse the burned area or cover it with cloths that have been soaked in cold water. Use ice water. Avoid using butter or any type of greasy ointment because they can interfere with healing and cause an allergic reaction. Second and third-degree burns with open blisters should be wrapped with a loose, dry dressing. Treating carbon monoxide poisoning. Improperly working camp stoves and lanterns, as well as wood and charcoal fires, can produce lethal carbon monoxide. Symptoms of carbon monoxide poisoning include headache, dizziness, weakness, and difficulty in breathing. The victim's skin can turn red, and he or she can lose consciousness. Get victims into fresh air immediately, and keep them lying quietly. Prompt medical care is essential. Treating a chest wound. A bullet striking the chest can cause a sucking chest wound, a deep, open wound of the chest wall that allows air into the chest cavity. All chest injuries are very serious and need immediate medical attention. To respond immediately to a chest wound, use the palm of your hand to cover the wound until a bandage is located. Cover the wound with sterile gauze, a clean cloth, plastic, or foil. Make sure the wound cover forms an airtight seal. Hold the gauze in place with a bandage or tape. If the victim has trouble breathing, remove the bandage and replace it quickly. Transport the victim to the hospital with the injured side down. First aid, drownings, heart attacks, and falls from tree stands. Treating drownings and heart attacks. A heart attack or injury, such as drowning, that causes the victim's heartbeat or breathing to stop will require CPR, cardiopulmonary resuscitation. Take a course to learn how to perform CPR properly. Falls from tree stands. You're always at risk of falling when you hunt from a tree stand. Make plans for a worst-case scenario. Establish a signal that will let your companions know if you fall. If you are hunting alone, what you do depends on your injuries. If your injuries are immobilizing, use your signal and then wait until you're found. If you can move, consider your location and decide if you can make it to help. If you have broken bones, sprains, or cuts, use what you have available for first aid. Clothing and large handkerchiefs can be used to stop bleeding and provide padding. Belts, hull lines, and branches can be used for splints. When hanging from a full arrest system, use a rope or strap to relieve suspension trauma.